Hello, my name is Katie Lutat, and I'm in the Science Internship Program. This fall, I will be a senior at Riverside High School. This summer, I worked in Euclid Hospital's CHF CKD clinic, and my project was titled The Effect of Nursing Education on Readmission Rates of Skilled Nursing Patients with Congestive Heart Failure. Congestive heart failure, or CHF, is a chronic disease caused by weakening of the heart. Here's a picture showing the enlarged heart and decreased volume typical of CHF patients. CHF is characterized by retention of fluid in the body, congestion, which typically causes swelling in the ankles and abdomen, and fluid retention in the lungs. Common symptoms include coughing, fatigue, swelling, and weight gain. It is important that patients are weighed by themselves or nurses daily to make sure a constant body weight is maintained and that fluid retention is not increasing. Patients must also consume a low-sodium diet and manage the condition with the correct medications prescribed by the patient's physician or other healthcare provider. It is crucial that nurses in skilled nursing facilities, or SNFs, monitor a patient's symptoms and recognize changes in his or her condition to reduce risk of more serious complications and hospital readmissions. Nurses must also ensure that patients are consuming a diet consistent with their physician's orders and patient's weight is taken at the same time daily. Starting October in 2012, Medicare will not reimburse hospitals for CHF patients that are readmitted to the hospital within 30 days of discharge from the hospital. This is why it is crucial for caregivers to take a more active role in patient care in and out of the hospital and that patients are educated about the care of their condition upon being discharged. I hypothesized that educating nurses in skilled nursing facilities and nursing homes about the care of CHF patients and management of their disease will improve patient care, thereby decreasing hospital readmission rates in patients with congestive heart failure. How I carried out this project was nurses from area nursing homes were educated about congestive heart failure through a PowerPoint presentation and lecture titled Heart Failure, Improving Patient Outcomes from my mentor, Donna Walker. Nurses taking part in this lesson were surveyed pre- and post-discussion about their knowledge of CHF. I also searched data for the locations from where patients were readmitted, and readmissions were examined in facilities before and after nurses were educated about CHF and its treatment and management. According to news reporter Sarah Jane Tribble of The Plain Dealer, the clinic's rate of readmission for heart failure patients enrolled in Medicare is 28% as compared with the U.S. rate of 24.7%. Euclid Hospital saw a 30% hospital readmission rate for congestive heart failure patients from SNFs and nursing homes alone in 2010. Common reasons for readmission to the hospital include CHF, UTI, renal failure, pneumonia, and COPD. Next, I have the evaluation nurses were given to determine their knowledge increase from the lecture. Here's some of the questions. So before the course, if they strongly disagree that they are knowledgeable, they put a 1, or if they strongly agree that they were knowledgeable on the topic, they put a 4, and after they answer the same question. And here are my results. There was an average 3-point average for being knowledgeable before the course. And after, there was a 3.5 average with an average increase in knowledge from 3 different nursing homes of 18.15%. According to a study in JAMDA, 30% of patients that were discharged to a SNF, 18% were readmitted to the hospital within 30 days, and 33% of these readmissions occurred within 7 days. Another study in JAMA stated that identifiable factors contributing to HF hospitalization were captured at admission and included ischemia, arrhythmia, non-adherence to diet or medications, pneumonia, respiratory process, hypertension, and worsening renal function. Based on my expected results, hospital readmissions will decrease as patient symptoms will be recognized sooner and patients will be cared for in the nursing facilities. Medicare will also reimburse hospitals without readmissions within 30 days. The Cleveland Clinic's overall readmission rate of 28%, as well as Euclid's 30% rate, will both decrease. I recommend that nurses continually monitor patients, water retention through weighing at the same time daily, diet, making sure it's low sodium, and that they are taking their medications prescribed by their physician. SNF and nursing home nurses should gain as much knowledge of the care and potentially dangerous symptoms of chronic diseases such as CHF to care for patients and keep them out of the hospital. I would like to thank the Office of Civic Education Initiatives, my mentor Donna Walker, and my co-mentor Vicki Gardner for giving me this opportunity. I would also like to thank my parents for their support.